Okay, will you go and stand with those clinicians over there?
I'm a nutritionist.
A nutritionist. Will you stand with a physiotherapist?
Over the course of the first week of the first Joint Advanced Seminar, JAS 1, PhD Fellows focus on a specific public health question through a series of group activities.
We do a spontaneous thing to divide them into disciplinary groups, and they then answer a question about what the contribution is of their discipline to a particular health issue, which in this week we picked under 5 child mortality and morbidity.
We are all in the same group. We're working on a literature review for under 5 mortality.
Where we're looking at a contribution of our discipline to our understanding of neonatal mortality. So we need to come up with the literature that is relevant to the topic to help us study it more.
They're basically engaged in looking for papers with regard to mortality, morbidity, and children, relating it to their discipline itself. So that's why they're basically in different groups where they were put in with their specialities so they could engage with each other on finding the literature that is published.
CARTA involves facilitators with a variety of skills, such as librarians, to support and guide the fellows as they tackle the problem that has been set.
Discuss the research together.
In a way, week 1 is partly about the fellows getting to know each other, but also about them learning skills which will be useful later on in their PhD. So they learn about referencing, they learn about how to do a good literature search online and so on. And then we weave those skills in with an activity which is really about opening the fellows' minds a little bit around research. And so that is really introducing them to the epistemology and ontology.
Because you have to hand over to her.
We ask them to describe their discipline, and we ask them to be very explicit about the epistemology of their discipline. What methods does their discipline use to generate evidence? And we get them to share that with each other. And what's important is that those disciplines are able to give different kinds of information that are all important. There isn't a hierarchy between disciplines. One isn't better than another. It contributes differently.
What's happening there? Okay, let's finish up here.
Each group has a turn to describe their field or discipline, explain how it works, and what it can contribute to our understanding of the specific problem.
So we picked up one environmental determinant of health, which is water, sanitation and hygiene, which is more associated with diarrhea. And we realized that diarrhea is actually among the top 2 causes of death among under 5s, followed by respiratory infections.
Thank you.
I didn't hear you talk about air pollution at all. Does it have a role to play?
The built environment is where we also look at air pollution, both indoor air pollution and outdoor. So it plays a role.
So the engineers will come up with access to roads and transport, for example. The people from social sciences might come up with gender issues, like that women have to ask either their mothers-in-law or their husbands for permission to go to a clinic.
Is it at an individual
After
level,
presenting their findings,
household level?
fellows organise the information according to a conceptual framework.
It's an individual level. Okay, so everyone here has achieved some level of education, and it will vary from individual to individual. So if you have access to clean water, running water, what level do you think it's on? Individual, household, community, national, or global? Okay, it's probably at a community level, because remember that you have to have water that is actually running to your household, which would be at a community level.
Through this activity, fellows come to appreciate the value of a conceptual framework. By integrating the different pieces of knowledge from different disciplines into a bigger picture, a conceptual framework offers a fuller and clearer understanding of the specific issue.
Decision making. But it's not just between the partners in the household, also between the parents, who often serve as the caregivers for the children, although the community may also come in sometimes.
So you're talking about social norms. that are operating at the community level, which could be influencing household decision making. Okay. Any other pinks? Let's.
This one, health insurance access.
Health insurance access.
We're looking at it as a social security policy.
And then there's also cross-border migration that happens, and do you think that's a global issue? Okay.
I think as a biomedical scientist, we haven't been looking on some aspects of social concepts. If we are not including social scientists, if we are not including any other person who understands these social determinants, then our methods of study or designs won't be adequate to answer our research gaps.
One piece of advice that I would give to facilitators would be really to trust the process. Because in some ways it's unpredictable. You don't really know what's going to come out of any exercise or activity. So you don't need to know exactly how it's going to happen, but rather focus on the broader objective. It's trusting that they will get there.